I think the reason today's celebration is so important because in the health service sometimes we're not very good at reminding ourselves how much we've achieved and how hard and how well people have worked on so many important initiatives. You know, we get our heads down, we get on, that's the way. And we don't stop and smell the flowers a bit, if you like. This trust has had a fantastic period of work through Safer Patient Initiative, now into 1,000 Lives. It's achieved a great deal, which has been recognised externally, but it's very important to recognise it internally, and that's why celebrating like we are today is so important, really, and such fun as well. Yes, I think our leadership walk rounds have really been very important in developing all that we're doing here. We took a slightly different approach here, and we invited the non-executive directors of the board to become involved as well. So on a regular basis, clinical leads, executive directors, and often non-executive directors as well, have walked the patch all over the trust in all sorts of areas, just listening, asking questions, trying to make sure that we got across as well as we could to all the staff involved that we were very committed to this agenda and we really wanted to hear about the problems. Yes, I mean, you do learn a lot because the great thing is people are willing to be very open because they know it's important and it's so important for everyone. Some of the issues we heard about were familiar ones that affected the whole trust, but often we found out about issues that actually with some sharing of information in a better fashion across the trust or some relatively small resource or some relatively small process change could be resolved. And our hit rate is about 50%. About 50% of all the issues that have been raised we've solved, the rest we're still working on. So I think they've been incredibly valuable, really. Well, we're fortunate in the new chair is very clear that that's a high priority for him. I always think of quality and safety as being, it should be like the lettering in a stick of rock. It should run all the way through. And it seems to me the trick with this reorganisation is to make sure that that thread, if you like, is continuous, is not disrupted, not disturbed. We bring the work together across the community, we keep working with colleagues nationally, and we make sure that it's a very high priority for the organisation. So far, all the signs are green that we'll be able to achieve that, and that's great. I think the 1,000 Lives campaign is critically important, really, for NHS Wales. And the reason is very simple, because what can be more important than the safety and the quality of the services that we provide for our patients? And that's the bottom line of it, really.